I'm joined by Dr. Rajiv Jaydevan, who is the member of Public Health Advisory Panel in Kerala State in IMA. So thank you so much for joining with us. And right now, Kerala is going through a difficult situation where we are seeing Nipah virus has become a concern. Now, you come from Kerala. My first question to you is, what is really the situation when it comes to Nipah virus? I believe there are 4 to 5 active cases that has been confirmed. What is really the situation on ground in Kozhikode?
At this time, the priorities are threefold. One, to deliver the best possible care to those who are suffering from the infection, which, as you know, has a high mortality and complication rate. Second is to track and find as many people who might have had contact with these patients and prevent them from further spreading the virus into the community. And the third is to communicate clearly to the population at large, to the world at large, as to what the right thing to do is and what to do and what not to do, and specifically to counter misinformation, which tends to be rampant during situations like this. So,
all right.
as you know,
so I want to, continue. Yes.
As you know, today morning, as expected, they found a patient who had tested positive, and that was from diligent contact tracing. When you track, say close to 900 contacts, 1 or 2 of them will invariably have it, and that's what is expected. And the advantage of that is twofold. As I said, A, you can pick them early and deliver the best possible care rather than catch them late when the complications have already set in. The second is they can be isolated and their contacts can be tracked with greater diligence. So that's the importance of contact tracing, and it's best done aggressively at the outset rather than wait until it gets too late.
All right. My second question is that why Kozhikode? Why do we see these cases, Nipah virus cases, time and again in Kozhikode? In 2018, we saw 18 cases. In 2019, then once again in 2021 as well. And now in 2023, once again, Nipah virus is being witnessed in Kozhikode. So why specifically Kozhikode? What is really the reason?
Yeah, it is not only Kozhikode. In fact, in Kerala, there was a patient with Nipah who survived Nipah that was found in my district. That's in Ernakulam district. That's maybe around 300 kilometers away, thereabouts. So this area that is right now in focus is frequented by bats that are known to harbor the virus within their bodies. And what is fascinating in one sense is that these viruses, Nipah included, are able to live in the bat for a long time without causing any discomfort or disease. So the immunology of it is that the immune system of these animals do not fight these viruses much. So the virus lives along with them and the bat learns to live along with it. So it's like a peaceful existence. And that's not the case when it jumps into an abnormal host, say, for example, human beings. So that is really the problem. And the survey of bats in India has shown that these bats containing the Nipah virus exist in multiple states in India. So that brings me to the second point. It's incredibly difficult to diagnose Nipah. Remember, fever is such a common condition. Show me one person who hasn't had fever in the past 6 months. So the initial symptom is fever. So you can't really be testing everyone with fever for Nipah. You can't be testing everyone with fever and respiratory symptoms, breathing trouble for Nipah. It could be from influenza, it could be from tuberculosis, it could be from viral fever, it could be from heart failure. So if you find such a patient in a compatible clinical scenario, if you will, or epidemiologically, if it is linked to a high possibility of Nipah, I'll take you, since you asked me the question, I'll take you through how doctors make diagnosis. Let's say I see an 18-year-old person in my clinic with chest pain. The person is very anxious because that person thinks they're having a heart attack. But what's the chance that an 18-year-old is having a heart attack? So the odds of him having a heart attack is actually quite smaller than when a 58-year-old smoker with diabetes comes to me with the same symptom. So likewise, when symptoms present to clinicians, there must be what is called an index of suspicion, which should be high in belts like this area where Nipah has occurred before. So the clinicians in that area know how it happens. So Nipah actually features in what we call the differential diagnosis. It might not be the top diagnosis, but when we write down the possibilities, we'll say viral fever, influenza, COVID, Nipah, and when a person who has abnormal, say, neurological signs, for example, behavioral changes or difficulty with walking, yes, Nipah rises to the top of the list in such situations. So that's a long answer to your question. If you have diagnosed it before, if you've experienced it before in your clinical practice, chances are you will pick it up again.
All right. My last question to you is that will the situation be controlled in the coming days? Will we see a similar situation that we saw in 2018, where there were, in fact, 17 deaths due to Nipah virus? So by the kind of, of course, there are a number of initiatives that has been put forth by both the Union Health Ministry and the Kerala Health Ministry. But is there chances that this might go out of hand?
It will not. I'll explain why. All viruses have what is called an R0, or the reproduction number, or basic reproduction number. The designated R0 for Nipah virus across the world, it's 0.4, with minor variations depending on the study. Now, that in plain English, it means that if one person gets this virus, that person is capable of spreading it to an average of 0.48. Now, that might sound like Greek. Now, I'll put that in plain English. Let's say 10 people get Nipah infection. How many people will pick up how many people will these people spread the virus to? It will be 4 people. And those 4 people will only spread it to one person. And you see, it dies down naturally, if you will. But that does not necessarily mean that we should not do anything. That doesn't, I'm not implying that we must be complacent about it. Aggressive contact tracing is important because of the high mortality rate. That is the thing that that sets Nipah apart, because of the high mortality rate. We can't even afford to have even the slightest error of judgment. Suppose we miss one case of COVID because of low mortality, it may not be that bad. But Nipah, if we miss one case, that's almost one death that could be prevented.
Are you saying that the infection rate is comparatively less when we compare it with COVID?
Yes, absolutely. COVID has an infection rate of around 2 to 3 on average, depending on the setting. I'm simplifying things here, which means if I get COVID, I could pass it on to 2 people or 3, and those 3 can give it to 9, and those 9 can give it to 27. Whereas in Nipah, it goes in the other direction. If 10 people get it, 4 will get it, and then 1 will get it, and then 0. So it goes downward in that sense, which is why all instances of Nipah outbreaks have been self-limiting by default.
All right. So I want to end this by asking you, what is really the prevention methods that can be taken by the public at this point, especially the people in and around Kozhikode in Kerala?
Yes. It's a very good question. If you ask me, the number one priority is to figure out what it is that made the virus jump from a bat into the first patient, what we call the index patient. That part is not clear. Yes. I'll explain why it won't be clear, because in many instances, the index patient would have died, and it will be difficult to track exactly what happened to that person, as to what exactly that person did to acquire this virus. So in other words, bats are ubiquitous animals. There are hundreds of thousands of bats everywhere. They frequent my house here in Ernakulam district. So not everyone is coming down Nipah. So there has to be something that triggered this, and we need to identify that X factor. Once we identify that X factor, we can advise people to not engage in such activity. Until then, we will not have a clear picture as to how to prevent another outbreak. You can't eliminate bats, which is absolutely impossible and doesn't make any biological or ecological sense. The second thing is, as we discussed earlier, a detection mechanism that can promptly pick up upon suspicion rather than wait around for days. So that these mechanisms are already in place. In fact, the place in Calicut where this patient was diagnosed, it was picked up very early, but the confirmation, official confirmation from NIV, that's the technicality, but the diagnosis was made very early.
All right. So thank you, Dr. Rajeev Jaydevan, for joining us and giving us all your insight as far as Nipah virus is concerned. We hope the infections get contained as soon as possible. Thank you.
Thank you.